Welcome to the latest edition of the Mind-Gut Conversation podcast, a place to learn about new ideas from thought leaders in the area of optimal health, the science of mind-gut microbiome interactions, food, and the environment. Today, I have the great pleasure to speak to Larissa Trinder, Assistant Vice President of Arts in Medicine at New York City Health and Hospitals, who is responsible for stewarding a collection of more than 4,000 works of art, the largest such collection in New York City. In addition, she has been creating and implementing programs for patients, staff, and the community that utilize the arts as a tool in healing. I had the pleasure of meeting Larissa recently at an event at the New York Public Library, where both of us spoke. Larissa has a master's degree in public policy from New York University's Robert F. Wagner Graduate School of Public Service. Before joining New York City Health and Hospitals Department, she worked for more than 10 years at Children's Hospital of the King's Daughters in Norfolk, Virginia, in philanthropy and creating programs to integrate the arts into the hospital system. Larissa is a staunch advocate for the importance of the arts and humanities within the healthcare system to advance patient health outcomes, enhance staff engagement, morale, and retention, and to empower communities. Welcome to the show, Larissa. Let me start out with something with sort of that's on the website of the Arts in Medicine program, and then I want to hear exactly what your role is in this, and can also talk about how we met. So let me just read this verbatim. The Arts in Medicine Department at New York City Health and Hospitals is part of a larger system-wide strategy to support workforce wellness. The department fosters the emotional well-being and promotes healing for patients, families, and caregivers. This is accomplished through activities and programs that utilize the visual, literary, and performing arts throughout the health and hospital system. Quite honestly, this is a topic that I have not thought about before I heard you talk in New York at the New York Public Library. So you are a key part of this program. You're the assistant vice president, and you have spoken on this program. So maybe if you could give a brief introduction of your role and how you came to this program and what your goals are.
Sure. So thank you for that. I have a little bit of a non-circuitous track to this position. My background was in development and fundraising for many decades. And the last position I had at a hospital in Virginia, I was the director of principal giving. And through that position, started to bring in a lot of people in the art world to support, initially as donors. And what we started to realize, and I worked with several significant artists at the time with patients, was that integration of the arts into the healthcare system was really something that was lacking. And so we developed an art policy, a creative art policy, and, cut to about a decade later, they have a very robust and growing program in my previous system. But what happened with New York City Health and Hospitals is really, I think, kind of singular for several reasons. And, the actual department really was more only formalized in about 2018 to be what it is today. And I'll talk about that in a minute. But historically, the department was really based on this really unbelievable visual art collection that we have that dates back to the 1930s during the Works Progress Administration. And so at that time, FDR wanted to very practically employ artists and create immersive experiences in public municipalities. And so we have dozens of WPA murals throughout the system, and they're quite spectacular, and they're very large and immersive. And they had been placed initially in staff lounges, in patient spaces, and some have been moved, some have not. But this early idea that the arts were an additional avenue to support healing and to support people's experience in the hospital was sort of a profound one, not in history, but really for this system, we are the largest public safety net system in the country behind the Veterans Administration. And the system is comprised of 11 long-term care, 11 acute care facilities, 5 long-term care, and over 70 clinics in all 5 boroughs. And it treats about 1.6 million New Yorkers every year. So there's really and employees, by the way, about 45,000 employees. So there was really the use of this visual collection was to equitably distribute it throughout that entire system I just described, to contribute to healing environments and to contribute to patient and family and staff's experience. But I think at the time it wasn't really studied the way it has been now to sort of demonstrate how incredibly essential and effective that really is starting to look.
I mean, if I may interrupt, I mean, what I couldn't believe, I mean, the size is like 7,000 pieces of art are contained. So the biggest, I mean, the largest art collection in the country.
It's one of the largest public art collections that we know of in the country that's in a non-museum setting, for sure. And, you know, we have some incredibly significant pieces. We cross-pollinate with many of the same artists that are at the Met, that are at the Whitney Museum of American Art, that are at the Brooklyn Museum. So, you know, and we do some programming with those institutions as well. So it's really quite unbelievable. And it kind of remained, honestly, a hidden secret until we've had some wonderful exposure with PBS, and then with a recent article this past fall on the history of the collection in the New York Times. So it's been an amazing opportunity to make sure that we're providing these pieces and spaces where our patients, as I said, patients and staff reside. The other arm of arts and medicine is the programmatic side. So we have several evidence-based programs that we deploy, and the majority of what arts and medicine does is focus on our staff, because there is a deep recognition that if the staff have the care that they need and the mental health support, then that will correlate with better patient care, better compliance, all sorts of different things. So, and we have some patient programs, but a lot of our facilities also have them. So that's one of the reasons this was really a broader system-wide strategy. But let me back up for 1 second and also just say the other unusual thing about the arts and medicine department is a structural decision made by the system to place this department on the cabinet for quality and safety. So I sit at in a cabinet with 14 other entities representing the entire system, and it's anything from head of infectious disease to the NYPD and security and data and analytics and arts and medicine, because there was and wellness. And so, you know, we are all tasked with making sure that we are looking out for the culture and safety of the whole organization. And Dr. Katz, who's the current CEO, really kind of recognized that this was an important thing to do when he took office in about, I think he was there 2017. So he and Dr. Eric Way both really recognized that this would be an important thing for them to do as they looked towards lots of different avenues to support the staff in the system. So as I said, we're a larger system-wide strategy. It's a 3-pronged strategy that includes H3, which is helping healers heal, which is a secondary victimization peer support for mainly physicians and nurses once they go through traumas that that healthcare workers entail all the time. Then there's a wellness one that has a very robust LCAT, or clinical art therapy program. And then there's arts and medicine. And the distinction between the latter two is that the LCATs, and art therapies are seeking clinical outcomes, whereas we are providing art interventions and art making as an additional resource to support mental health. So that's sort of just the balcony version. And then there's a lot of nuance to that as well.
Yeah, it's kind of amazing that, you know, hospitals in general and probably public hospitals even more so are a place that create a lot of anxiety and severe stress amongst the staff and the physicians dealing with, you know, really impossible situations and life-threatening situations and suffering. To bring art into such an environment is an amazing you know, feat. I mean, now that I've read about it and listened to your talk, and we've been talking about it. It makes a lot of sense. So, but I don't think people have really come up with this in any significant way, particularly on that large scale.
Yeah.
I mean,
Yeah, it's
there's
it
art therapy and psychotherapy, and but not on a scale like this.
No, and it's interesting though that there's a lot happening in the field right now. This is a really big moment for arts and medicine programs worldwide. And I think the big sort of universal question is, what is it that we need in this life to thrive? And, are we looking for longevity? And I know you've talked a lot about that in some of your discussions, and that we have, achieved so many medical, amazing breakthroughs that we can live a long time. But what does the quality of our life look like? And, thinking about all of the things that create awe and joy, and what really looks like a flourishing life, is a huge part of that is the arts and cultural interventions, the arts and humanities. And so, the fact that to me now, it's so obvious, but I think more than ever, because we're a public safety net, people, including staff, are already coming from high, traumatic or stressful environments. And the majority of we treat everyone regardless of their circumstance. We have the largest percentage of substance abuse and people experiencing homelessness and immigration and asylum seekers. So there's just these tremendous social layers on top of everything that are contributing to this kind of stress. But what I think's gotten really interesting, and I'm sure you're deeply aware, is this field of neuroaesthetics that is really looking at cortisol levels and what is really happening when you're under stress. And again, you could really answer that very, very easily. But I think that what they're finding and what's happening all over the world is that art interventions are decreasing people's stress levels, and they're feeling better in those environments. And that's then correlating, as I said earlier, with maybe it's better compliance with their doctors talking to them because they're calmer. So there's just all sorts of different ways that they're starting to learn about how not nice, or what we intrinsically know the arts kind of how they make us feel, but actually that they're sort of, I always say, they're an essential hospital piece of equipment. And that if you are not providing significant visual art and art programming, sort of, I believe, in the way that we're trying to achieve, then you're actually not really providing the best kind of healthcare. You're providing partial healthcare. So that's really become a very big mission of ours. But I think why this space is becoming particularly interesting right now is that on the global level, the World Health Organization, who's always obviously worked in the art and health space, has really sort of amped up their strategy around this. And they recently appointed, for example, the sopranos Renee Fleming and Preti Yundi to be ambassadors for them in this space. And Renee's doing some incredible work there. But she's, as a little sidebar, she's a really interesting example, because she said for years people would come up to her and say, "Your music saved me. Your music got me through my cancer treatments. Your music just really, really helped me heal." And she said after a while, she started thinking there's got to be some empirical evidence to this. There's got to be some additional reason people are saying this. And to her credit, she started to research it a lot, and has really been making some incredible headways. So the WHO has been very instrumental in that. But there's also been some, and the National Endowment for the Arts in this, I mean, there's just so many different kinds of global and then federal entities that are looking at this, and then state and local. But the most significant one right now, I think, in the United States is our U.S. Surgeon General, Vivek Murthy's report on loneliness and social isolation. And how are we addressing that as a country? And what are the reasons that people are feeling really lonely? And loneliness is like an illness, and it's something that can affect your stress. Obviously, have all these different markers to impact your health. So I think the fact that he's kind of raised the flag on that is really important, and it's creating some awareness. I think, as I said, WHO is as well. But then a couple states, it's Rhode Island and California, are really the leaders right now, Massachusetts as well, in this kind of idea of a statewide sort of interdisciplinary approach to the health of their communities. So they're looking at, in Rhode Island, the Rhode Island School of Design and some other local entities all came together to say, how can we really be thinking about the community's health? So they're kind of the trailblazers, the Rhode Island State Art Council, in kind of creating these sorts of frameworks that are supporting health.
I mean, in general, when you go to private, like when I look at UCLA, the Center for Health Sciences, beautiful new building, costs $1 billion to build, and with artwork in it. The same at Cedar Sinai was mentioned in one of these articles. So the well-to-do, the healthcare facilities for the well-to-do have jumped on that. I don't know if they jumped on it with the same realization or the same theoretical conceptualization of art and health. But this has up to now really been absent for the public health system.
Right.
I can't speak about New York, not experienced it, but I would imagine it's not common there. So
Right.
to have this situation as an example, as a leading example, that you have one of the biggest non-museum art collections in the country, possibly in the world, in a space that's traditionally not has not embraced this connection between art and healing and wellness, is pretty remarkable.
Yeah, I mean, I think that it's interesting. I always sort of joke that we kind of get we're so big of a system that we can always say, oh, we are addressing the most people in this population, and so we have the most art interventions. But the reality is, what you just said is very true, that there's a lot of the Cleveland Clinic, for example, has an incredible art collection. I mean, there's a lot of other more affluent systems that have for many years brought in art for different reasons. And Mount Sinai, I mean, some of them were one donor or a couple of donors or collectors, but others, the system itself sort of recognized that their clientele would probably want to feel comfortable in those places. And so, I do think it's not only unique, but again, really incredibly important that we are considering that for our populations, particularly because the social disparities component and all of these other reasons that people are in our system to begin with, I think that makes them even more it's even more important that they get exposed to these things, because a lot of the people that we serve may not go to museums on a regular basis or may not have access to do that. So we've done a lot of different things to make sure that we can create that access. We're on the Bloomberg Connects app, and we're using that in new patient packets for people to download so they can be in their bed and they can see all the artwork in the hospital on their phone or on a tablet that we may provide. So there's a lot of different ways to really be thinking about how we're using the arts. But one of the programs that I think is one of our most significant programs is called Heart of Medicine, and it's an empathy building workshop that really kind of started with a physician at Yale in the early 90s, where he recognized that his young residents were, obviously tired and overworked, but they were just making really sloppy diagnostic conclusions. And so I'm sure you've heard of this, kind of model, but he brought them to the Yale Art Museum and said, we're going to look at art. And he recognized that after a period of time, that looking at, observational art, and now we know this has been researched, really helps to deepen empathy. It really helps to create better diagnostic skills and all these things. So we've sort of iterated that model, and we will use a piece from our collection. We'll project it on a screen with a group of staff. And sometimes the staff is from all different areas of the hospital in one room. It's about 30 people. And other times it's very specific customized teams. So it could be palliative care team, or we're working with the Correctional Health Services on Rikers Island right now on a series of workshops for those staff. But they hear from an art curator from one of the museums that we're partnered with. So let's pick the Whitney Museum. We'll bring their educator and an LCAT. the art therapist, and they'll go through an art observation session and then an art making activity, and then a group, sort of like a group therapy share out at the end. And what's really remarkable is you would think that people would feel hesitant to speak in a group like that, or maybe a little vulnerable. But what happens is people really start to feel this shared experience in the hospital, and it creates some team cohesion and really a deepened, empathy for one another. So that's been a very growing, a very, important program.
You get a lot of buy-in from the physicians. I mean, who is more affected or excited about this program? Is it a physician
Yeah.
or the staff or?
That's such a great question. I always joke that, we're the only department that we never bring a problem. Everybody loves us. When arts and medicine comes to support them or do an exhibition, I mean, we do a lot of different things. They are joyful because they know we're bringing happiness. We're not there to, do any, that's our entire goal. And so, but it's interesting. Our clinical teams, our providers really appreciate it because they too are looking for myriad ways to support the mental health of their staff and their teams. And post-COVID, our health system, obviously, like many others in the country, if not all, really suffered a lot of workforce, people leaving. And so how are we creating an environment where they feel cherished and valued? And so one of the ways is to not provide necessarily opportunities for them outside of the hospital. We do some of that, but really to come where they are during their workday. And I think that they feel if the system is sort of creating an infrastructure that engages them during the day and gives them a contemplative moment or two, it's definitely helping them feel an enhanced trust in the system and a greater sense of belonging. And we're starting to do some pretty robust evaluation now on how that correlates with the mass block burnout inventory, and what if that's really connecting to retention based on some of the different things that we do. So the clinicians really appreciate it. And when they find out about it, because for some reason they haven't, because it's such a big system, I'll get emails all the time that they said, I'm just finding out about this. This is unbelievable. Can you please, can we do one of these programs for our teams?
Yeah, I mean, I can imagine that there's a lot of young physicians. I think that what this would be really appealing to. I mean, I remember from this public library event, there was a young physician, but this wasn't about art. This was about volunteer work,
Mhm.
helping the uninsured
Yes.
medically.
Yeah.
So that kind of spirit, I think, would be particularly, people with that kind of attitude would be particularly attracted to having these
Yeah.
environments.
Well, yes, and that's Dr. Jimenez for New York City Cares, and that's an incredible program. And actually, it's interesting you brought that up. And that's just another one of the ways the Arts and Medicine department will partner. So they are doing a rebranding right now of that so that they can get that out to the community. We have, as you know, an increase of immigrants in New York City right now, and we're really looking to get them this incredible resource. It's like an insurance card that lasts a year, and it's just a very easy access point for them for our hospitals. And so he and I are working together with some of the artists that did art for our community mural program on developing some of the rebranding and what that looks like. And the artists that are involved happen to have been immigrants themselves. And so, there's so much cross-pollination in what we do that's not even necessarily actually the arts that you think it is traditionally. So there's just so many different ways that we're constantly sort of seeking gaps in the system and ways that we can help.
Yeah, I mean, what I read in this in this New York Times article, so it's a few pictures of Keith Harding, whom I did, quite honestly, not know before, but the beautiful murals that he painted.
Mm-hmm.
When he did this artwork in the hospital, I mean, first of all, the way he chose the place where he wanted to do that, and secondly, then how he interacted with people coming into the
Patients.
hospital is sort of amazing, really.
He is an amazing, remarkable young man, because what he did, and that's actually an extremely significant mural. It's three it's one mural, but it really is comprised of three very long, and it's massive. And it's extraordinary. So he went and he lived in a hospital more or less for 2 weeks and really interfaced with staff and patients and families to sort of inform how he was going to, figure out what kind of a mural he wanted to do. But what's so great about what he did, he was really able to use his art in general to highlight awareness around HIV. And so, he ultimately died of that in the late 80s, but he is a great example of how an artist can talk about difficult and complex issues that are facing society. And another fantastic example we have of that, we have several in our system, but another one is a young artist named Amanda Finkapakata, who did a mural for us, but then became very well known during COVID for Asian hate crimes because of the it being called a China flu or whatever the negative labels were. And she created these beautiful murals all over New York City, and then they went all over the world, that really was able to raise awareness for this and help support anti-Semitism. So again, there's just so many different ways that, the artists not only build these beautiful environments, but are able to raise awareness for different service lines and different things that we're trying to do that are strategic priorities for the system.
Yeah, I mean, to see medical centers, hospitals, clinics as healing environments is I mean, this is sort of at the core of this. At some point they were basically just meant to be like, like repair places. People go there because something is broken down, and it's sort of a mechanical reductionistic approach to fix the problem and get the person out as quickly as possible. But with a lot of the chronic problems that people have, it's a different approach is required, which is this integration of multiple components and create a healing environment overall, which is holistic. It includes the mind, it includes aesthetics.
Well, and I think what you're also sort of getting at is this whole idea, I may have shared a little of this with you, but around social prescription. And, the social prescribing movement has been pretty alive and well and successful in Europe for, a little less than a decade maybe, but it's starting to, and I think its success is partly because the healthcare models are very different there than they are here, and our challenges are different. But the essence of social prescription is providing non-medical interventions to support your health. So it could be, we did a study a couple of years ago with, it was a food prescription for for newborns in the Bronx. And it was in areas that were considered food deserts. So when these children were born, they were given a 2-year supply of free, fresh produce that came to their door every week. And obviously that correlated with brain development and all sorts of other things very well. So that's one example. But with art and cultural interventions, social prescribing is really taking off, and we're looking. I'm constantly looking for ways to consider different system realignments with some current staff that could then take on this task. And how it essentially works is the provider gives you your medical, your medicine. So let's say it's your Lexapro or something. And then they offer you, or the social worker does, or a community link worker, whomever that point of contact is, says, okay, we know that you like these, you've identified, and there's a lot of different ways to do this, these different things that you're interested in. So, why don't you choose one? Okay, here's a 6-month dose of ceramics class, or different kinds of art, or poetry or literary. And, after 6 months, they come back and they assess it. And, I don't know, to my knowledge, has anyone ever said, no, I don't want to do this anymore, because it's given to them, it's free, it's accessible. And there's a bunch of different kind of models being built right now to consider different frameworks. But that is definitely something we're looking at. And I'm really looking a lot at how to do a social prescription model for our staff and what that would look like. And so we have some, sort of incremental, we're doing some little things now. We have wellness concerts at Carnegie Hall, and we offer, some really interesting things that they can do outside. But again, looking at that other empathy workshop, what are the things we can bring to our providers during the day to support them from a cultural standpoint?
Yeah, it's fascinating. Coming back to a pretty mundane question, and with all these exciting projects they're doing, so I mean, what's the business model, or who's actually paying for all of this?
Yes, great question. So a couple of things. So we've been very fortunate. We have a grant and a very wonderful partnership with Lori Tisch, who runs the Tisch Illumination Fund, and she has supported myriad things throughout New York City in her lifetime, but really decided in about 2018 she was looking for gaps in art and health intervention. She's done a lot with the arts in New York City, and came upon the public system and recognized that that was obviously one that really could use something like this, particularly, as we all know, during COVID and post-COVID. So she really catalyzed it with a gift, I think about 5 years ago, and has since been really instrumental. So it's that, but we also write a lot of grants, and try to pull it together in a lot of different ways. But we're very fortunate to have that, have her support.
So you have a background in fundraising, and uh, did you always have this interest also in this medical, the healing aspect? Has that always been there, or has this evolved with your work in fundraising?
Yeah, no, I think it was a myriad of things. I think so. I have three sons, and my middle son, who's 24 now, when he was a little boy, he was about 5 and was diagnosed with pretty extreme dyslexia. And we were constantly trying to figure out what could we do to keep his self-esteem intact. What can we do? This is really going to be a struggle. And we knew he loved art, but we didn't know he would ultimately become a talented artist. So we would provide him with all sorts of art interventions, and take him to different places and expose him to different experiences. And he kind of glommed onto animation and kinetic imaging, and is now getting his master's in the city in this very area. But I saw what it did for him and the value that it brought to his life and how it enhanced his joy. And so I always kind of had that orthogonally in my mind as I was kind of going through my journey in fundraising. But as I mentioned earlier, it was really when I was at the Children's Hospital, and I partnered with an artist from the Midwest that wanted to work with the children um, in our oncology department, and develop glass fish to hang from the lobby. And this experience was so profound because not only did I see obviously what happened with the children and how that was such a great experience for them and the parents and the families, but it also created this broader sense of community with the glass studio, with the museum down the street, with people, so all of these different entities were sort of coming together. And it just kind of dawned on me at the time that this would be really an interesting idea and something that they hadn't done at all. So that was sort of how I came into it. And so the fundraising background's a great kind of skill set to have, but this really is such a joyful and an honor to do what I do, because I just feel that there's so many endless opportunities, and there's so much passion from artists to want to be involved and to want to contribute. And it's elevating, I think, artists' stature really in the world. As it sounds a little silly to say healers, but they really are in a lot of ways. And so using them in the healthcare models is becoming, I think, a more of an important thing to do.
Yeah, and I think particularly, I mentioned this a little bit I mean, traditional medicine has been very successful dealing with acute injuries and acute diseases. Obviously, um, historical achievements just along the antibiotics, but surgery. But the medical system has not been very good in dealing with the chronic, uh, the chronic disease epidemic, the chronic non-contagious disease epidemic. And more people are affected by this with all kinds of chronic illnesses. And I think to expand the model of healthcare to create these healing environments, not just the mechanical fixing of an acute problem, I think is absolutely essential. And
Yeah, I mean, the CDC has said there's 5 or 4 different, very preventable illnesses that can really be supported through different interventions, and the arts and healing are one of those. So I do think, I mean, we partner with a lot of nonprofits in New York City to work on supporting non-communicable diseases. We do a lot with Dance for Parkinson's, for example, and different movement and things that we know to support them. So I think you're right. I think there's just a lot of different ways that it was so siloed for so long, and it kind of still is, that it's about time they think, if, again, you have your medicine, but are you doing these other 10 things? And if you're in our public system, you may not have access to fresh food or, some of the things that more affluent systems are able to offer. So, being in this role and being able to offer some of those experiences has really been very special.
Yeah, and also like, I mean, part of it, I think there's almost a dichotomy now. There's people that are really physicians in their training. And I see this, when they come to us as pre-med students or the first semester, and it's probably not a coincidence that the majority are female, physicians or students. They love these holistic concepts. They like when they come to our center and we talk about the mind and the brain and how all this is connected. And once they go through I would almost say brainwashing of medical school that prepares them for dealing with a patient in a 15-minute conversation, and then during that time even sitting in front of the computer and typing in the notes rather than looking at the patient or touching the patient, is so that's one direction. So you have these two, and some of these students or young physicians, they survive that brainwashing and maintain this interest for the holistic thing. I think what you're doing is just, this should be propagated to as many of those
It should.
patients so they know there's another way of dealing with it, with
Well,
this.
it's interesting, the young residents or the young fellows that we've started to do when they come into our central office and go through the quality and safety cabinet and are working for us. We've started to give them a program, a Heart of Medicine session, and some other things related to arts and medicine. And one of the first questions I'll ask them, and these are incredibly intelligent young people, are, what do you think, how do you think the arts play a role in healing or supporting public health? And I mean, they're smart enough that they can kind of make some great academic, connections. But once they have these sessions and they realize they're allowed to do these contemplative things that were normally, historically in medical school, I'm sure 30 years ago, just looked down upon. You had to work and work and work. And, I think that they really, really value it. And the chief medical officer at Harlem Hospital, Dr. Maurice Wright, tells his residents every week, he said, this weekend, you have to go out into nature for an hour or something, and he really commands them to. And he loves all the visual arts, and he incorporates it into some of their meetings, and he'll go to one of the WPA murals and they'll talk about one of the images, or we'll bring in one of my staff people will go and, really do an education session. So I think that you're right. I think that it would be, and I think that students that are studying science and those kinds of, that kind of curriculum really could benefit tremendously from the arts and the humanities for their mental health, but also just to enhance their skill level and their skill set and to be able to connect with people. And that's why people, I would imagine, go into medicine to begin with, is to help others,
Yeah, and the interesting thing, I mean, for me as a scientist, it's interesting that we now have ways of, there's this whole field of psychoneuroimmunology, this, how the things that we perceive and feel about and are stressed about gets translated in our body into gene expression in the immune system, and it may not directly make you sick, but it plays a big role in increasing vulnerabilities and counteracting these negative influences that come, from the outside. The art would be a positive one. But you have to always realize, I mean, this is not just staying in your head. It's not just feeling better. It's actually being translated in biological processes that play a big role in maintaining your health or improving your health. So, yeah, when I listen to you, that alone, makes me think about all these potential mechanisms, biological mechanisms, how this gets translated into, into health and resilience.
Yeah, I mean, I think, our community mural program that I think I spoke a little bit about at the public library that day, really is a wonderful exemplar of all of this work because it brings together the staff and patients and the community in these focus groups. I mean, there's like 6 or 7 different kind of stages for each of these murals that we put into the system. And that's what I was sharing with you earlier, was that we are partnering with the Jamil Art and Health Lab at NYU in the World Health Organization to do the first large-scale study of what the public impact of immersive murals are in healthcare settings. And in my system, I think it's going to be particularly interesting because we really want to make sure that we are creating a sense of trust in the system and a sense of belonging and a sense of community. And so, we're working right now on what those evaluations will be, what they'll look like. And then ultimately it's going to expand to a system in Slovenia, Nigeria, and the UK that all are also doing different versions of muraling and bringing communities together. So, that when we identify the sites each year for these murals, it's really interesting because sometimes they're in a staff space, or sometimes it's out on the street, so there's just all sorts of different ways. But the leadership are so excited because they know it brings their entire system together to create these murals and have fun. And the artists are just wonderful as well. So, yeah, I mean, I think there absolutely needs to, this whole idea of art and medicine and healthcare just really needs to continue to move quickly forward. Because I think that what we're going to find, that again, we both sitting here today probably intrinsically already know is true, is that the empirical evidence is going to show that this is something that is pretty obvious we should be doing in a meaningful way for full holistic health.
Well, I think this is a great statement, to conclude this conversation. I really enjoyed it. I have to say, it's a lot of new territory for me in some ways, but I can totally relate to it. And I'm thankful that, we both met by serendipity at this
I
New
know.
York Public Library event, because otherwise it may have taken me a lot longer to find out about it. So thanks so much, Larissa, for this conversation.
Oh, thank you so much. And thank you for all the incredible work that you're doing that I'm a little bit more well-versed in now. I appreciate it.